Today, we have the honor of sitting down with a physician who does not just treat symptoms. He empowers people with clarity, compassion, and real understanding in a world overflowing with confusion about health. Dr. Stephen Sabo. I'm just trying to be careful. He's a dedicated doctor whose voice has become one of the most trusted in the metabolic health, with decades of clinical experience and a gift for breaking down complex science into something deeply human and accessible. He's helping countless people navigate one of the most talked about breakthroughs in modern medicine, GLP-1 medications. But beyond the science, what truly sets Dr. Sabo apart is his unwavering commitment to seeing the person behind the patient. To cut through the hype, the fear, and the misinformation, and to speak with honesty, humility, and genuine care. He is not here to sell you on a quick fixes or miracle cures. He's here to share truth, perspective, and the kind of wisdom that only comes from ears at the bedside. So whether you're curious, hopeful, skeptical, I want to say that, or somewhere in between about the GLP-1, get ready for a conversation that will inform your mind, touch your heart, and leave you feeling truly seen. Please join me in welcoming Dr. Stephen. Thank you for being on Key to You.
Thank you, Shruthi. It's great to be here today.
And I do want to get started with, you have dedicated nearly 3 decades to emergency medicine. What's the most profound, painful truth you witnessed about how most people actually lose their health? Not in a sudden crisis, but gradually by ignoring warning signs. And how did that realization propel you from reactive ER care into founding this glass enterprise and focusing on longevity entrepreneurship?
Well, first of all, great to be here. And 3 decades, boy, that sounds like a long time. It sounds like a real long time. And I guess it was 28 years practicing
I know.
New York and New Jersey. And
Yeah.
so your question, chronic illness, it's so sad because chronic illness is really the cause of most of what I saw in my career in my 28 years. And chronic illness led to, it's leading down the path to other problems.
Right.
I mean, so many problems. I would say the majority of problems that I saw in the ER really can be traced back to some form of chronic illness. And so I had this epiphany, I guess you would say, at one point, and decided that I wanted to treat people before they got sick proactively instead of reactively, which is what medicine is very good at. But why not try to treat people before they get signs and symptoms of disease? And there's a lot of studies. Look, medical people want studies. There's a lot of studies on products, on treatments that can be given, taken, done before people get sick. And it's just such a wonderful field, proactive medicine.
And it is so important right now. Proactive is better than reactive at any given point in time for anything in the life. So totally agree. Related to that, right? You have emphasized that people ignore the subtle warning signs until it's too late. With chronic conditions like obesity, diabetes, or metabolic diseases driving massive cost right now, right? What are the top 2 to 3 silent red flags you wish every listener today understood and acted on before ending up in an ER?
The red flags. First, I would say if you have some type of an ache or a pain and you don't know the answer for it, you should seek out medical attention. Okay. I think that's the most important thing. A lot of people will have chest pain and think it's not something serious. And then when they come in, it may be very late. And
Mm,
so talk to your doctor, talk to your healthcare provider, and do it early.
yeah.
I would say certainly that's important. And
Okay.
something else that what was it? Could be a warning sign,
I
or
mean,
what was it?
yeah, any kind of red flags, right? People normally don't pay attention and pay close attention towards some subtle signs in your body that it until it's too late. So, are there anything that you did you so generic and so many people have that you have seen misses?
Oh, I think there are a lot of things. I think, as I said, if you have some type of chest pain, I think that's really important to speak to your
Right,
doctor.
right,
Something else that I just thought of, when you try to self-diagnose yourself, I mean, if you have some mild pain or whatever,
right.
I think even as doctors, we try to diagnose ourselves, and
Yeah.
doctors have doctors, and so
Do you?
yes, yes, or they should,
Yeah.
and seek out medical attention. I'm not
Hmm.
telling you to run to a doctor for everything,
Right.
but there are people that with many health conditions who wait sometimes until it's too late.
Right. Okay. So let's get into the GLP-1. We're in the midst of an obesity and chronic disease epidemic, the GLP-1 medications. And interestingly, it's helping for the weight management and related conditions as well, generating enormous excitement in the country and in the world, I would say, not even in the United States alone, but also huge cost pressures for patient, employers, insurers, and government programs in 2026. And what I really want to know is what's your balanced physician guided prescriptive on these innovations versus sustainable lifestyle? But I think these medications are also important, and to know what is the GLP-1, how is it going to work on your body? Is there anything that is that the things that you need to be aware of, the side effects? So let's start with that.
So, what is GLP-1? It stands for glucagon-like peptide.
Okay.
What's interesting about GLP-1 is that it was found in the body, but it was found to be very short acting. And several of the things that GLP-1 substances do, they bind at the GLP-1 receptor. And when they do, they can regulate insulin levels, regulate blood sugar, and they can help shuttle sugar into the cell. They also can cut out the food noise, which makes it so great for weight management. And if you go back, they found that the GLP-1 that we have in the body is very short acting, short lived. So it doesn't last long. And so for some reason they tested Shruti, a Gila monster. I don't know if you know what a Gila monster is. It's
What is
reptile,
it?
actually.
Okay.
It's a reptile in the lizard family.
Oh my God.
And
Okay.
they tested the saliva. I'm not
Okay.
making this up. Saliva, and I don't know what gave them the idea to test it,
Right.
but they tested the saliva of a Gila monster and they found longer acting GLP-1s. And that's where the synthetic products come from, the synthetic GLP-1s, the prescription ones that are out there, the injectables. And,
Okay.
and they've just rearranged some of the science of it to come up with
Okay.
it with these products. So they all work the same, but they cut out the food noise. And that's really one of the keys here. It has so many effects on the body. It can make you feel full longer. So
Is it a good thing?
it's a good thing if you want to lose weight. So you take your plate of food.
Yeah.
You take I mean, we have an oral one, but the
Yeah.
injectable ones, whatever.
Yeah.
And what it does is you first of all, the food noise goes down, so your appetite goes down. But then when you're eating, you get full quicker. And so theoretically, you don't eat as much.
Right.
And so,
Right.
so that's what GLP-1 stands for. That's what it is. And you have the injectables, which there's very different dosing to, and then there's our new oral one as well. But
So there's so much stigma around, like, is it safe?
excuse me?
Is it safe to consume? Is it like, do we have any side effects that we need to be worried about? I mean, if you want to elaborate a little bit more around that. Yeah.
Sure. So with the GLP-1s that are out there, the common side effects, there's nausea, there's constipation, there's hair loss. And these are and the hair loss is probably due more of a rapid weight loss. So if you lose a lot of weight in a short period of time, it's probably, studies seem to indicate that it's probably due to that as opposed to the GLP-1 itself. But we're lumping that in there because it does occur with GLP-1 patients. And sometimes the nausea and the constipation is so bad that they have to stop the product.
Okay.
Yeah, I remember working with a doctor, and he had been on an injectable GLP-1 when they first came out, and they were just using it for diabetes. They weren't even using it for weight loss then. And I remember him. I asked him if he was okay working in the ER that day, and he told me he was nauseous from the GLP-1 that he was taking, but it was working really well to regulate his blood sugar. So he wanted to stay on it, and he didn't need to lose any weight. And by the way, if you take these products, the GLP-1s, you don't go way below what you should weigh. So you may end up using this for metabolic health, for blood sugar regulation, and you may lose some weight, but you're not going to wither away to nothing because your body's just going to reset, what your weight should be. But you'll still get the benefits, the metabolic benefits.
Okay.
So side effects, and then there are some more unusual side effects that have been seen with it. Thyroid cancer, which is very rare.
Okay.
And some other things, some eye issues. But lots of protective effects from the GLP-1s.
Okay. In anybody listening to our conversation, we're not saying that move away from considering taking GLP-1. It's like they need to talk to their physician. They need to understand. I mean, does it matter? Like everybody in their condition, how it stands today, does it matter whether they can take the GLP-1 versus they cannot, or anybody can take the GLP-1?
No, and I've never prescribed the GLP-1 working in the ER.
Right.
But clinicians, so it's doctors and nurse practitioners, PAs, chiropractors, lots of dentists. There are lots of clinicians that are prescribing them, and they do an evaluation before they prescribe the GLP-1.
Okay. So affordability has become number one barrier too in the American healthcare this year, especially. People delaying the care, facing high out-of-pocket cost, and dealing with the medical debt. And how do one adopt a proactive longevity mindset, which would help them reduce the overall healthcare spending, number one, but also improve their own health? And how is this, let's say, I want to take an example, doctor. An obese, somebody is as really obese and really want to take the GLP-1 medication, but it's too expensive for them to afford. How would you help them address, like, what would they need to do from your perspective?
I can't really comment on that. Like I said, I don't prescribe those medications, and I don't know what's available for people. I know the costs are very high for the synthetic GLPs, the injectables, and I don't know what insurance
What?
pays on these things.
Got it. Got it.
Well, I
Okay.
don't know. We have an oral natural one that's new to the market.
How, what do you say about the oral one that's new to the market? Do you really like that compared to the injectable, or like, what's your perspective?
So are we talking about the one that the company I'm with makes?
Yes.
Yeah. So I'm on the board of a company. We make an oral natural GLP-1 product. So this product is really great for people that don't want to take the injections, and
Mm-hmm.
also for people that want something that's all natural. This product comes from Norwegian salmon and
Mm-hmm.
mushrooms. And so we don't worry about the dose. So people take it, generally it's a dropper bottle, and you
Okay.
take it 3/4 of a dropper twice a day. You take it 30 minutes before you eat or drink anything, so it doesn't interfere with absorption.
Mm-hmm.
And it doesn't have the side effects that we just talked about. It doesn't have the nausea, doesn't have the constipation, doesn't
Yeah.
have the hair loss that you see with the other ones. And there's another issue with the GLP-1s out there is loss of skeletal muscle. You know,
Mm,
Shruti, you've probably seen a lot of these movie stars, and they get so
yeah.
thin that their
The
face,
whole thing jaw is like, drop
right?
down.
So there's something called Ozempic face,
Yeah.
which is from these products. No, what happens is
Right.
they lose the skeletal muscle in
Yeah.
their face,
Right.
and they lose skeletal muscle. Our version, the initial study has indicated that it actually promotes skeletal muscle.
Oh, that's
And
good.
I, interestingly enough, took a body, those body composition scans they have at the gym, where you
Yes.
stand on there,
Yes.
measures
Yeah.
basal metabolic rate, and you grab the handlebars, and
It'll
so
scan you the whole. Yeah.
in the 2 weeks now, I work out 3 times a week. I do strength
Mm-hmm.
training. I
Mm-hmm.
eat a lot of protein. And by the way, anybody that I recommend this product to, or any of them, I recommend strength training as
Yeah.
your doctor allows you, but that's
Mm-hmm.
important. And
Mm-hmm.
protein consumption to increase that again, as your doctor says it's okay.
Okay.
And so I was doing that along
Mm-hmm. Mm-hmm.
before I started on the GLP. I had plateaued in my weight loss. And
Wow.
so I took the body scan. I took it right around the time I started, and then 2 weeks later, I lost 5% body fat in those 2 weeks, 5%, and I gained 4 pounds of skeletal muscle, doing nothing different except taking this oral natural GLP product. So that supports the head scientist who developed this.
Yeah.
267 peptides is what this product is made out of.
Mm.
And it shows that skeletal muscle actually increases. And again, I recommend to people that they should increase their protein consumption and go to the gym and do strength training.
And this is very interesting what you just said, doctor.
Mm-hmm.
Oral medicine, that is, you're one of the customer of it. Like, you have taken that for 2 weeks, you have seen the before and the after effect, and it's only positive. That's number one. And number two, you said that all of the side effects that we just talked through with an injection one, like hair loss, or whether there were two more, doctor.
Nausea and constipation.
Yeah, nausea and constipation. None of that were observed, or none of that side effects were applicable for this version of the drug. And that is a key. That's a key for everybody to understand. And people who are listening to our conversation, I think this is going to be very important for the people to know. I know my husband wanted to also look at, and what we heard is it's going to help with the blood pressure, having a controlled and balanced BP, blood pressure as well. And I don't know how much of that is true. This is something that we heard.
I'm sorry. That's a good point, actually, about with the blood pressure. That's interesting. it does tend to lower the blood pressure slightly. We have, in fact, we were discussing this with one of our partners. Her sister decided she wanted to take it because she had heard that it can lower blood pressure, and she had borderline elevated blood pressure. And her doctor had said, "You know what? I think we're going to have to start a blood pressure medicine." So she took it, and after 2 weeks, her blood pressure totally normalized. Went back to her doctor, and who said, "You don't need the blood pressure medicine right now."
Wow.
So, yes.
That's a great point, and I'll be very much interested to know that, because I think many of us need to understand that a little bit too. So what if people are taking it? And again, I just want to cover this aspect too. People are taking the medication, the oral one, and they're not keeping up their diet appropriately, not enough protein consumption, and they rarely hit the gym or take care of their, what happens?
I mean, it's hard to make a generality like that. You'd have to measure the skeletal muscle like I measured myself. You'd have to measure it in these people, and I think most people are not going to go for that. And I also think that there are a lot of people that aren't going to follow that advice. It's the quick fix thing.
Right.
A lot of people just want to take a pill, take something orally.
Yeah.
And, speaking of orally, let me just address another point. There are a lot of companies that say they have a GLP-1 oral natural product. And when you look at it, these are products like berberine, for example, which is a good supplement. And they say it's GLP-1, but it doesn't actually bind, into the receptor like ours does, like the injectables do.
Okay.
And it stimulates, acts around it. That's different.
Yeah.
And so also our oral product, we use 13 different absorption technologies in our products, various products. And we use 2 of them in this product. And that helps the product go through the gastrointestinal tract. It gets absorbed sublingually, so you hold it in your tongue, under your tongue first a little bit. But then it helps shuttle it through the gastrointestinal tract and helps it actually go and get absorbed in the intestine. And so it increases absorption. And we should say that a couple of the injectables just got approved for the oral version. I don't know if they use any absorption systems with them to increase absorption. I don't know.
And that is most important, is what you're saying, right, doctor? I mean, the absorption is critical for these medications.
It is. I mean, look, there is a saying out there, all you get from supplements, because ours is considered a supplement.
Yeah.
All you get from supplements is expensive urine. In other words, you take it in and you pee it out because it doesn't get absorbed. But our company has absorption technologies that we use with each of our products.
That's amazing. Are you well known, Doc? I mean, is that product is out there? I mean, maybe I may need more information so that I can publish when we have this video published. People need to know, here is the oral medication, which is much more beneficial, and here is what it, how it benefits you from an oral health perspective. I do like to give some information around that. So I
was going to say, you can put my contact information or social media when we're done with this, and people can get in touch with me that way if they're interested.
Absolutely. And looking at you, Doc, I mean, you look so smart and so active and so energetic. I'm sure this 2 weeks of you testing that out on you would have been absolutely working on you well, with not a side effect at all, or else you would have mentioned that to me. So that's the proof right there.
You know what? We've had people taking this product that have lost 23 pounds in a month, 25 pounds. It's not everybody, My wife lost 9 pounds in a month. I lost 5 pounds, but my whole belly, my whole abdomen is totally shaped differently now. I mean, it's almost 3 inches smaller. All my pants are loose on me. But
I life. I want to be there. I
but
want to get
but
there.
but here's the thing.
Yeah.
When you get rid of muscle and
Yeah.
you get more, I'm sorry, when you get rid of the fat and you increase
Yeah.
the muscle, muscle weighs more than fat.
Yeah.
So, a lot of us want to think, oh, I didn't lose that much weight, but then when you look down and you realize that your pants are loose on you, and my wife's clothes are loose on her,
Yeah.
it's really doing more than that. And
Exactly. I will blush for the day when I get rid of my, I would call it mommy tummy.
Mhm. Never heard
I,
that expression, but we have some customers who wanted to do that. Yes.
yeah. So
Um,
any story that you can share where people have taken it and how it impacted them and how they were in tears or overwhelmingly happy. Any story that you would like to share?
I do. I've got a really good story from a woman in our company, and she tells the story. This product was introduced at our leadership event in Texas in the middle of January. And
Okay.
there was a woman that was there who was, I don't know if she's 5'1" and very
Ooh,
heavy, hobbling with a cane, diffuse
yeah.
joint pains.
Ooh,
And she got a bottle of it there. This is one of the people in a month, she lost almost 28 pounds. But at the 2 week mark, she told us, all the swelling, her legs were like tree trunks. All the swelling in the legs went down and the joint pain went away, and she got rid of the cane. She hasn't used it. That was months ago. And
that's,
yes, she lost 28 pounds, but I'm just as happy for her
yeah.
that, that she lost the inflammation, the swelling. And again, GLP-1 products are anti-inflammatory. They get rid of inflammation.
Right.
So just a great result for her,
Absolutely.
like a new person, basically.
Must be
Yeah.
such a beautiful feeling for her. It's like,
That's why that's why I was a doctor for so many years. Just,
it-
it wasn't even for the thank you. It was just to feel like or know that you made a difference in somebody's life.
right.
And here, you know, um, people, have lost the weight, and they say, what a difference you
Yeah.
made. Or,
Yeah.
other customers just on the GLP-1. I've had so many people, want to try this.
Hmm.
It's a great feeling. Absolutely.
Right. And I can imagine the two things I do want to say. The first one is, uh, Dr. Steve, when you and I talked a few weeks ago, you mentioned something that really stayed with me. You said, you're an ER doctor, have a very busy, crazy day, but once you're done with the day, you walk around everywhere and, greet all the nurses and say thank you.
It's not that especially when it was a tough day, and being in the ER, we had a lot of tough days.
Yeah.
And a lot of times it's a thankless job. I always say that the most thanks we ever got was during COVID, at the beginning of COVID,
Yeah.
when, pizza places would be sending us pizza,
Oh, that's so
and,
sweet. Yeah.
you know, uh, people would drop stuff off because they knew
Yeah.
what we were dealing with.
Hmm.
It's a lot of times it's a thankless job. And, whenever you got commented on how you were, what you were doing, it was usually that people above you were, covering their
Right.
ass, so to speak. And so we
Right.
didn't get a lot of, positive feedback. And
Right.
so I just felt that it was not just nice, but encouraging. And
Yeah.
I specifically go out of my way to the nurses that I worked with
Yeah.
and say, thank you. You did a
Yeah.
great job today, especially with, this patient or whatever. And
Right.
sometimes they would just look up and just smile, or, hopefully
It-
I made their end of their day feel a little better after such a tough.
Absolutely. I would say that's the most beautiful thing a one can do
Mhm.
as a leader, or as a, even as working with somebody, making them feel they're seen, they're heard, and they're thanked is such a good gift that you could give. And that
Recognition, that's the word.
recognition, yeah,
That's
the
the word.
recognition. There you go. That's the right word.
Absolutely. Some people live for recognition.
Oh yeah,
Not even the
oh yeah.
money sometimes. They
Exactly.
live
They
for
don't care about the
recognition.
title. They don't care about the. They need to be seen. They need to be recognized. To your point, I mean, that
Seen
is
and
so
heard.
beautiful
Yep.
of it. And the second thing is, I kind of like, I feel like when most of the people, like myself too, I'll take my own example. It took me 7 years to really overcome that feeling of me being on a camera and I'm okay, I'm looking good, my voice is good, for me to kickstart the podcast. But that is so important to us, internalizing it, our own self, like how we look or how we, how we present ourselves matters a lot. If I'm obese, or if I'm like, I'm dark, or I have no hair, or whatever the case be, my confidence will be down. I will be shelling myself somewhere, not putting out there, and being me, right? So in what you just said, an example of a woman coming out there and saying, in 2 weeks after me taking this pill, I shed the weight, inflammation is gone, and I look good. I mean, she must be feeling so good about the way she looks, and the way she looks will help her to how she feels as well. So, great job there.
I can only imagine. By the way, we have a liquid, we have a dropper bottle, but
Okay.
I can only imagine. And you know what else is interesting
Yeah.
is that she's been one of the most successful people in the company since then. Because think about it, she
Yeah.
loses the weight, she loses a lot of weight, and she
Yeah.
walks around, and people say, "Oh my God, what happened to you? You're taking something? I want to take it too." She sold
Exactly.
more bottles of this stuff than like anybody in the company. It's like the walking billboard, you know?
There you go.
It's a walking billboard.
Right there.
I can only imagine how she feels because
Yeah.
I mean, my wife and I have seen not huge, but differences,
Yeah.
and you feel good. Do you know what I mean?
Yeah.
I feel good that my belly is, mostly
Yeah.
gone. It's not six pack
Exactly.
abs or anything, but I mean, look, we all want to look good. We all want to live longer, and
Exactly.
so this is just something that you can take to help you.
That's awesome. I want to get, there are a couple more things that I do have that I wanted to talk. You have transitioned successfully from a clinical practice to a global business mentoring and wellness innovation. For healthcare professionals listening to our conversation who feel stuck in the traditional reactive system, what advice do you have for pivoting towards entrepreneurship in longevity or proactive health, or anything that they're looking for, that more physician specific, while still making meaningful impact?
It's a really good question out there. And I just actually, what you're referring to is burnout.
Yeah.
And there's a lot of it in medicine, and it's very sad.
Yeah.
Or doctors or health professionals feeling that they need to do something different, but they feel like they don't know what else they can do.
Right.
And I actually was just, and they're releasing it. I was on a panel, a burnout panel, so to speak, to talk about burnout with two other emergency doctors. And it's a whole doctors group. They did pediatricians this week. I think my session comes up in a few weeks, and
Okay.
we discuss different issues like this. But I would
Mm-hmm.
say the first thing is to recognize that you, as a healthcare provider, may not be fully happy or fulfilled like you
Yeah.
were before. I mean,
Right.
I loved my career. I worked 28 years as an ER doctor. And one of the things I always did was I didn't bring it home. And I found that to be very helpful. I look, my wife and my daughters are pretty squeamish at the sight of what I had to deal with. And I'm going to tell you, I certainly would have to give the mild version to them. My father was a surgeon, and I can imagine that I wanted the details when I was growing up, because that's how I was.
Right.
But I think it's really important for healthcare professionals, we'll say, who feel that they need to do something different to see what's out there. And there's a lot of stuff that healthcare professionals can do clinically outside a hospital or a practice that might be more regular hours, for example, because I had, 50% to a third of my shifts at different times in my career were night shifts. And those were very difficult to deal with as I got older, we'll say.
Yeah.
So I would say, reach out, use resources with the internet. There's a lot of things out there. You can contact me. I know some of the resources. I'm happy to, to speak to anybody who wants to, clinical, non-clinical. I can't say I know everything, but, but that's what I would say. Know that there are options. There's always options out there.
That's awesome, because I do realize that every profession has a burnout, and as a human, what do you need to do first? How do you cleanse yourself? Like, how do you just unstress? There's no word as unstress, but I'm going to use it today. We got to know how to get out of the stress feeling. You got to do something towards that. That's number one. And number two is like,
and what you do to de-stress may be very different than what I do.
Exactly.
I listen to Tony Robbins' priming every morning, which includes gratitude. I have over here, I have my gratitude journal. I cite 3 things of gratitude every morning. Before my 7 a.m. shift, I live 8 minutes from the hospital. I get up at 5 a.m. because I had a whole routine that I did. So I called it my time for meditation. It was one of my favorite parts of the day. And, it's anxiety provoking working in an ER. So anything I can do to help myself get more chill before the shift was certainly good. And getting back to your question before about, what can these healthcare people do? I have several people that work with me on the team that are, I have a doctor that I used to work with, a physician assistant. We have a lot of medical people on our team. So
you can always have that support.
Yeah, you can always contact me, and I could get you more information.
I'm glad there's a community of support for healthcare professionals too. That's awesome. So looking ahead in 2026 and beyond, with advances in personalized medicine, AI, and anti-aging science, what's one trend in longevity and wellness you are most optimistic about? And one potential pitfall we should guard against to truly extend health span, not just lifespan.
I love that. Did we talk about that? About health span and lifespan? Because I talk
No, we did not.
I talk about that all the time. I mean, do you want to just live longer? That's health span. Or do you want to live healthier longer? That's health span. And there's a big difference. There's a big difference there. And there's a lot of things that, as I transition into wellness and longevity, I went to the Anti-Aging Medicine Society conference over the weekend, and we learned about GLP-1s and other things that are out there. And one of the pitfalls is relying too much on AI. AI is great. It really is great. But don't rely that it's 100%. Getting better, certainly, but don't rely that it's 100%. And I do believe there's no magic drug out there. There are peptides for everything out there. I'm learning. I did emergency medicine for so many years, so I'm still learning about what's out there for longevity, and it's really, really fascinating. Myself, I like focusing on education and educating people on what's out
Right.
there.
Right.
That's really my
Knowledge
passion.
is bliss.
Yes, absolutely.
So this is, this was such a profound discussion, and I do want to. Lastly, I do want the audience to leave with 3 things that you like to share, that they can process it, understand, and work on. Any 3 things that you like you want to leave the audience with.
Since I'm focused on longevity, I would say it would be longevity. And diet and exercise that we've always talk about. You want to increase your protein again, and diet and exercise. Assuming your doctor says that it's okay. I mean, if you can't get out of bed, you can't. So with whatever your doctor says, because these 2 things, eating right, eliminating junk foods, foods with food dyes in it, eating these processed carbohydrates all day long is not healthy for you. But you got to tell yourself, you got to want to do it. And so one is the foods that we eat, and try to eat as much whole foods as you can.
Yeah.
And then number 2 would be exercise and strength training. And I follow this doctor. She's a longevity doctor. And she talks about muscle span and the fact that skeletal muscle is the organ in your body most important for longevity.
Okay.
And I was one, Shruthi, that did not ever really like to exercise. I mean, I like tennis, I like skiing and ice skating, but going to the gym, I mean, no. I mean, when I was
My
in
husband
college,
is like
I
that,
went,
so I'm trying to figure out.
and it was college when, it was all sweaty, smelly gym, and then I probably didn't really go to a gym again lifting weights until maybe about 10 years ago. And I went pretty regularly for several years, but then the pandemic and I stopped going. And then I'm proud of myself because next month will be a year that I've been going, except for, vacations and stuff like that, regularly, with strength training. And it's all about consistency. I believe consistency is so important. So that would be number 3. Be consistent. And the best time to do something is now.
Very well said. Now, and I would say, people hearing our conversation, GLP-1 is an interesting oral GLP-1 drug that Dr. Steve, you talked about. Learn more, understand more. It has a lot of benefits. And if you want to know more, do contact Dr. Steve, and we will drop the details in our podcast when we get this live. So with that, Dr. Steve, it was such a pleasure to have you on Key to You. Thank you so much for being with us.
Thank you. I enjoyed it.